Hello, how are you?
I'm great. How are you doing?
Fantastic.
Awesome. Come on in.
Thank you, thank you. Are you ready for your 73 questions?
Definitely.
All right, so let's get started. What is your name?
My name's Ben Schmidt.
And your specialty?
I'm a GI fellow, gastroenterology.
How many years have you been practicing?
Right now I'm a fellow, so I'm in my second year as a GI fellow, but I've done a 3-year internal medicine residency before that.
Gotcha. So where did you go to undergrad?
I went to Northwestern University up in Chicago.
And medical school?
I was at the University of Missouri in Columbia.
Did you take any gap years before going to med school?
No, actually, I was pretty confident that I wanted to be a doctor from early on, so I went straight through.
Good. Now, I know med school is not too long ago for you. Do you remember what your favorite part of med school was?
My favorite part of medical school, we did a problem-based learning curriculum, which was one where we would learn through doing cases, where we would have a case at the beginning of the week, and we would get more and more information along the way and kind of learn about the imaging and the labs related to that disease. And I thought that was a really fun way to learn, so I really enjoyed that.
Very familiar with it. I think we have something similar.
Great.
What specialty did you think you were going to go into on your first day of med school?
I was actually between psychiatry and neurology. I'd read a book about neurology that I really enjoyed. So that was something I thought about. And then psychiatry was always really interesting to me. So those were two that I was thinking about from the get-go.
Now, what changed your mind about those specialties?
I think there were a few things. Whenever you go to medical school, you go on rotations, of course, to experience those. And I think a common criticism of neurology is that a lot of these diseases, while they're very interesting, we unfortunately don't have great treatments for some of them. So it can be a little bit unfulfilling in that regard. So that was one that kind of pushed me away from that. And then my psychiatry experience in medical school, it was a good experience, but I think it was just very hard for me to deal with all the psychosocial elements of it. So that kind of pushed me away from that specialty.
Understandable. So were there any specialties you immediately said, absolutely not for me?
I think OBGYN was that way for me. I started on OBGYN as a third year, which is when I was doing all of my clinical rotations. And I didn't really enjoy any aspect of that specialty. No offense to any OBGYNs. I know it's a great specialty, but just for me, the surgical aspect I wasn't a fan of. Delivering babies, believe it or not, I didn't enjoy very much. So I said, let's cross this off the list.
Understandable. Oh, speaking of what you're in right now, what first made you fall in love with gastroenterology?
Yeah, absolutely. So gastroenterology, for me, I really liked the diversity of the specialty. So gastroenterology is really cool to me because there's chronic and acute conditions that you treat. There's emergencies and there's more long-term care. And then of course there's procedures that you can do. They're not overly intensive procedures, but you can kind of have that balance of doing procedures one day and being in the clinic the other day. So I like that a lot.
Nice. So how long does your training take after med school for those who might want to be in your shoes one day?
Absolutely. So when you're a GI doctor, one of the things is you have to do an internal medicine training first. So after medical school, you have to do 3 years of internal medicine. And then that gives you kind of the base to be a good internist, to be able to, take good histories and those sorts of things. But then you do an additional 3 years of GI fellowship. You can do more you can do more fellowships after that. But the main training is 6 years after medical school.
Well, speaking of more fellowships, are there any further subspecialties you can do within gastroenterology?
Absolutely. So gastroenterology has a few different sub-areas. I would say the most popular ones are hepatology, transplant hepatology, which is focusing on liver transplant specifically, getting patients tested for those sorts of things and ultimately getting them a transplant if they have complete liver failure or advanced cirrhosis. Then there's inflammatory bowel disease is another fellowship you can do afterwards. Advanced endoscopy, where you do procedures like ERCP or EUS, which are something that you don't learn in your main 3 years of GI training. And then there's even more than that. There's motility, there's nutrition. So there's a lot of things you can kind of hyper-focus in on.
Yeah. So did you ever consider getting any other degrees like an MBA or an MPH?
Honestly, no, I didn't. I was someone who was always interested in being a doctor from a young age. I would say kind of in high school time frame is when I was interested. So I was always kind of knew what I wanted to do. And then from pretty early on in medical school, I knew I wanted to do GI. So I knew I was in for a long sort of training period of time. So there wasn't any aspect of those that appealed to me. And I wanted to just kind of get out there and get through my training as quickly as I could.
Great. And also, before I forget, who's the friend in the tank?
Oh yeah, he's hiding right now. It's Tyrone. He's a gecko. He's way back in the back corner. I don't know if you can see him. He's nocturnal, so he doesn't come out. But I like to spray his tank every so often to keep it humid in there.
Okay.
So that's important.
Sorry, my ADHD. Just wondering.
Oh, absolutely. He's got to be highlighted. He's a cool dude.
Exactly. Oh, what would you say is the most unique part of your specialty?
I think the most unique part of GI, kind of as I hinted at before, is the diversity of it, but I really think the instant gratification, so to speak, is really appealing. I kind of hinted at neurology. One of the reasons I shied away from that is because a lot of the times you can find these really interesting diagnoses, but you can't always do something about it. But with GI, there's a lot of things where you can diagnose it and you can treat it, even in the same procedure potentially. So you could do an EGD, an upper endoscopy, and someone who's having trouble swallowing. You can go in, you can see they have a narrowing, you can diagnose it, and then right there in the same procedure, you can do what's called a dilation. You can stretch their esophagus, and you can have them be swallowing better by that night. Similarly, if someone's having a GI bleed, you can go in and you can stop that bleed in a matter of minutes. Don't have to make any cuts, any incisions, and then later that night, they're fine, and they're going about their day.
Well said.
Want to get a drink? What's
sure.
going on here?
Oh, kind of adding on that, I always like to let doctors try to sell their specialty like a car salesman to any prospective students out there. So why should someone choose your specialty?
I think gastroenterology, again, I'm going to refer back to the diversity of gastroenterology, which really appeals to me. And I think anyone who wants to have a diverse kind of day-to-day life, whether that's something that they're going to have procedures one day and then they're going to be in clinic the next day, or they're going to be treating diseases that might just need to come in and you just get one treatment or one procedure and then you're good for the rest of your life, versus someone who needs to come in and see a GI doctor every 6 months. Someone who likes to have a lot of variety in their day-to-day is really going to enjoy GI. And I think that's what's really exciting about the specialty.
Well, on the flip side, why should someone not choose your specialty?
That's a fair question. I think a lot of people, either in my family or in my life, are asking me why I chose GI a lot. So I think someone who thinks poop is really gross or doesn't like to talk about poop on a day-to-day basis, I think that's someone who probably wouldn't enjoy GI, because you'll find that it invites people to ask you a lot of strange questions, both in your personal life and then, of course, in clinic. It's appropriate, but you get a lot of unusual questions about your bowel movements.
Yeah, that's a valid reason. So, are there any stereotypes of your specialty?
Oh, absolutely. Kind of along those lines a little bit. I think people make fun of us saying that we're obsessed with bowel movements, but I think in terms of positive stereotypes, I would say that stereotype that we're kind of funny and fun to work with, which hopefully I always try to live up to. And then in terms of kind of maybe negative stereotypes, I think a common joke among medical professionals is that GI doctors never want to do a scope in the middle of the night, and they always push a scope to the morning. There's some actual real basis behind that. There are studies showing that procedures shouldn't always be done immediately when it happens, but I think that's a stereotype that definitely shines through.
Well, are they true?
Somewhat, yeah. Definitely the positive ones are true. I think so. And then I would say the ones about us not liking to scope in the middle of the night are relatively true, but I can speak from experience. If we need to come in the middle of the night, we certainly will.
All right. So since you do work at an academic hospital, I'm sure you get to interact with med students. Mm-hmm. So what is your go-to question to ask them on the wards?
Ooh, that's a good question. I think starting always with kind of asking about anatomy, asking about the different types of or different parts, I should say, of the GI tract and the small intestine, because during an EGD, and not everyone knows this, we don't cover with an EGD and a colonoscopy, we don't reach both ends of the whole GI tract. So I think asking them what are the parts of the small intestine and how far do we reach on an upper endoscopy, and not something I necessarily expect them to know, but something they can definitely see firsthand while watching endoscopies.
Gotcha. Now, flip it around. What is the craziest question you've been pimped on as a student or resident, or even fellow?
That's fair. I think most of my traumatic experiences on that were in medical school. I would say I have a famous example that I've told people about a lot. It's not necessarily an unreasonable question, but it was just a funny experience where I was asked the different causes of anion gap metabolic acidosis, and that's a very famous question that med students get asked a lot. There's a lot of causes. There's a mnemonic that people often go through. There's a few mnemonics, but I was kind of panicking being a young med student. I was trying to think of them. I wasn't going in the right order of the mnemonic, and I named 6 or 7 different examples, and I forgot the mnemonic is mud piles, and I had named everything except the P from mud piles. But I thought I had done well, right? Because I had listed 6 or 7 examples of what can cause this type of abnormality, and then my attending physician looked at me and he just says, "What's the P?" And he knew that I had left out the P and that I hadn't thought of it, and I couldn't think of it. And now I'll never forget, the P is propylene glycol.
Great reminder for me. So are you ever nervous at all coming onto your shifts?
I think there's definitely an element of that. I think, especially me being in training, I'm not a full-fledged GI doctor doing everything by myself yet. So there's things that I just truly don't have enough comfort level with. But I think anytime you're doing a procedure, it's good to have some healthy level of anxiety that keeps you focused during the procedure, because there are complications that can happen with any procedure, even one as benign as a colonoscopy. So that kind of helps keep you focused. And then as a fellow, I always have a supervising physician to help me.
Gotcha. So these are some work-based questions, but definitely important for anybody who wants to go into it. Absolutely. How many patients do you see on an average day?
So I think I would have to answer that based on either how many patients do I scope in one day or how many patients do I see in clinic in a day. In terms of scoping, right now as a fellow at least, I scope probably between 6 to 9 patients a day. That's doing either a colonoscopy or an EGD. And then I would say in clinic, in a half day, we see 7 or 8 patients a day. So if I was doing a full day of clinic, it would probably be about 15 patients a day.
What's the most amount of patients you've seen in a day?
Well, if I'm on the inpatient service, I see a lot more patients, especially on the weekends. So, gosh, I would say that would probably be on the scale of 30 patients maybe in a day. Definitely busier on the weekends when you're on call.
What's your favorite procedure to do?
Right now, my favorite procedure to do is probably an EGD, which is an upper endoscopy, both because it's something that I've been able to get to excel at now that I'm a fellow, but also because there's a lot of interesting interventions you can do from there. In the sense that you can stop bleeding, you can do a dilation, stretching the esophagus like I alluded to, take biopsies to diagnose a lot of different conditions. So that's really fun.
How many hours do you work in an average week?
In an average week, I would say the big distinction is whether I'm on call or not, because if I'm on call, I'm going to work on the weekend, and if I'm not on call, I won't. So if I'm not on call, I would say about 50 hours a week, maybe 45, something like that. But if I'm on call, that can go up dramatically, be on the scale of 80 to 90 hours a week. So it can be a lot.
What time do you normally wake up?
I would say nothing too crazy early, maybe around 6:30 in the morning.
What time do you normally leave the hospital?
If I'm not on call, then I almost always leave the hospital by 5. So I would say probably around 4:30 on average. But if you're on call and an emergent procedure comes in, it can be a lot later. It could be 8 or 9 at night.
How many hours of sleep are you typically working on?
I need a lot of sleep. So I would say I try to do 8 hours of sleep a night.
Yeah. How many hours of sleep are you working on right now?
I think now I have more. I think I got 9 hours of sleep last night, so I'm doing pretty well.
It's a good day.
That is a good day.
So you mentioned this earlier, but do you have to take call at all?
Definitely have to take call. As a fellow, you do a lot more call than you might as an attending physician once I finish my fellowship. Luckily, I'm done with my first year of fellowship, which is where we have the majority of our call, and that could be on the scale of doing a weekend of call every month and a night of call every week.
Speaking of night of call, are you a day or night person?
Definitely more of a day person, so that can be a little problematic when I'm on call. Though I kind of tell people this as a fun fact, but I never did a all-nighter until my intern year where I was on a 24-hour shift. That was the first time I've ever stayed up for a full 24 hours.
You gotta do it some point.
Yeah.
How long does it take you to chart at the end of your day?
I wouldn't say it takes too long. One of the nice things about GI procedures, at least, is the reports that you write are pretty quick and you have time to do it in between procedures. So when I'm doing procedures, it's less than a half an hour at the end of the day. And then when I'm in clinic, I would say maybe 30 to 60 minutes, nothing too crazy.
A wholesome question. Who are you most thankful for on your care team?
Oh, that's a good question. I think the endoscopy nurses, the nurses that help us out at an endoscopy are really key. They can kind of help give us techniques. Obviously, our attending physicians help out a lot, but the nurses know a lot of tricks. They've, in a lot of cases, been doing this for a really long time, so they can help us out a lot. Why don't we go outside? It's so beautiful outside today.
Oh. Okay, this is a really good question, mainly because you're a GI doc.
Absolutely.
What is the funniest thing you've seen in a patient chart, without violating HIPAA?
Oh, that's a good one. I would say I kind of alluded to this a little bit earlier, but I often get a lot of, patients are coming in with unusual issues with their bowel movements, and I think descriptions of patients' bowel movements are commonly very kind of funny to read because you'll have, different people in the hospital describing it in a different way, the tech versus the nurse versus the ER doctor, and then ultimately me. So a lot of funny descriptions of bowel movements.
What's the most common medical advice you give to your patients?
Most common medical advice I give to my patients, that's a good question. One is to make sure that they're taking their heartburn medication, their PPIs correctly. A lot of times people have really bad heartburn and it's often because they're not taking those meds correctly. I would say taking a lot of fiber, or taking, not a lot of fiber, taking fiber can really help with your bowel movements as well. So I find myself often recommending that.
What's your favorite random nerdy medical fact?
Random nerdy medical fact. We get a lot of these in GI for sure. I would say one thing, the fact that you make a liter of saliva a day is one thing that comes up a lot, because we're often keeping track of if people are having like a lot of diarrhea or something, how much output they're having. You got to keep in mind that even if you weren't having any bowel movements or anything, you're going to put out a liter of saliva every day.
It's kind of gross.
It is very gross.
Oh, you're close to the end of your fellowship.
Mm-hmm.
So what are you most looking forward to as an attending compared to your time as a resident and fellow?
I think when you're getting out of training, the most exciting thing, of course, is having a little bit more autonomy and being able to make your own decisions. Right now, as you move along in your training, you get more and more autonomy, and you're able to decide on patient care a lot more than you were earlier in your career. But it's going to be nice to just be able to see a patient and come up with the plan, and be able to know that, you know, it's just kind of on me to make that plan and to decide what's best for the patient.
All right. Well, we've talked a lot about your life inside the hospital. So how about your life when you clock out? So what is your favorite thing to do when you are not working?
That's a fair question. I like to relax, watch TV and movies. I like to make some of my own short films in my spare time, certainly. So I make a lot of kind of silly healthcare videos, educational healthcare videos, and those sorts of things. So I think that's a lot of fun too.
Does your family ever ask you for random medical advice?
They do. My dad's a doctor, so he usually takes the brunt of that, I would say. But if they're GI specific questions, I get a lot of those. A lot of people with weird kind of, or not weird, I shouldn't say, but just abdominal pains that they want to make sure that are nothing to be concerned about, I certainly will get asked.
Well, I'll adopt the word weird. What's the weirdest question a family or friend has ever asked you?
Oh gosh, let me think. I think one thing that happened recently, at least, is I just got a text from my sister that her friend wanted to know what the best ER was in St. Louis, because she needed to go to the ER. So that was kind of putting me on the spot for a person I didn't know at all. So that was a little bit strange.
Favorite animal, not a dog or cat?
I've got to say gecko. We've already seen my awesome gecko, Tyrone. So they're really cool. Watch them climb on glass all day.
Any artistic hobbies you keep up with?
I would say my most artistic side is making my own videos. Doing the editing for videos I think is really fun and can be really therapeutic. So that's probably the most artistic that I get.
And how long have you been doing it?
I've been making videos for social media about healthcare and my healthcare experiences for almost exactly a year now. But I've been making videos overall since I was actually in middle school. When YouTube came out, I was kind of posting videos up there day one, way back in, I think, 2005, something like that.
Nice. If you could have dinner with anyone in history, who would it be?
Oh, interesting. I would say I'm really into movies, so Quentin Tarantino actually is someone that I've often given that answer for. I think I love his movies, and I think he's just a very unusual, eccentric guy, so I think it would be a fun conversation to have.
What would you guys be eating at that said dinner?
Ooh, I would definitely have salmon. Salmon's my favorite thing to eat.
Well, that probably answers the next question. What's your favorite dish to eat?
Salmon.
Oh, coffee, tea, or soda?
Definitely soda. I actually don't drink coffee or tea, which a lot of people are shocked at being in the medical field, so I drink some soda.
So how much water should you be drinking every day?
Oh gosh. I think I usually tell people like 8 glasses of water, 8 ounce glasses, I think is a reasonable amount.
Okay. It's always fun to see different physicians' answers, because literally
sure.
none of them answer the same thing.
Oh, I can only imagine.
Favorite meal from the hospital cafeteria, if you have one?
They actually serve salmon sometimes in the hospital cafeteria. It's like it's very rare. It's like this big moment, but yeah, whenever they have that, that's my favorite thing to eat there.
What is one thing you would say you are oddly good at?
One thing that I'm oddly good at, I would say maybe being able to diffuse a tense situation, like patients that are very either kind of frustrated or stressed about their hospital stay or something like that. I think being able to tell a joke, not in a sense of making light of their situation, but just trying to kind of cheer them up or make them a little bit more comfortable with our interaction. I feel like I'm pretty good at doing that.
It's a very useful skill.
Mm-hmm.
What is one random task you wish you could be better at?
I think time management is something that a lot of doctors could do a little bit better with, and I think finding time to spend as much time as I need to with my patients, but then also kind of doing the background things of being prepared and writing my notes and putting as much time into those elements too. Doing all of that can be a big challenge.
Pineapple on pizza, yes or no?
No. Definitely.
Favorite TikTok sound at the moment?
Favorite TikTok sound? That's tough. I really like the Good Soup one, the Adam Driver one. I've seen a few funny ones with that.
Great choice. Favorite comment you've ever gotten on one of your videos?
Oh gosh, that's a good question. My favorite comment. I mean, kind of in a serious light, I've gotten a few comments saying that people were inspired to kind of consider medicine as a career based on my videos. So that was one of my favorite comments that I've gotten. And I think for those of you that have seen my videos, I wear a lot of wigs. So I think one of the weirdest comments was that someone told me that they were going to ask their hairdresser to style their own hair after the wig that I was wearing in a video.
Strange compliment.
Definitely.
Top 3 music artists.
Top 3 music artists. That's interesting. I listen to a lot of different types of music. So The Weeknd, for sure, is someone that I'm a big fan of. I would say Franz Ferdinand is kind of something I was really into a long time ago that I've been really getting back into a little bit. And then, what else? Green Day.
Okay.
Let's go with that.
So, one song you would recommend anyone to listen to before they die?
Holy cow. We're getting deep here.
Oh, yeah.
A question or a song that I would want someone to listen to before they die. I don't have one off the top. I think the song Hallelujah is a very stereotypical answer, but I think that's just a very peaceful song, a very nice song to hear. So I think that would be a song that I would definitely want someone to listen to.
Great answer. What is the best way that you relax after a long day?
Best way to relax, I think, is to just sit down on the couch, watch some YouTube or watch some TV, and just kind of separate from things for a little bit, and then maybe watch a movie.
Night in or go out on the town kind of person?
Definitely more of a night in, like watching a good movie, I would say.
Indoors or outdoors?
I still like going outside, so I would say being outdoors, especially when nice weather like this.
Beach or mountains?
I don't like the beach. I don't like sand very much, so I would say mountains.
Would you consider yourself more of an introvert or extrovert?
Definitely an introvert.
And was that personality trait a factor in you choosing your specialty?
I don't think so. I think GI doctors are actually traditionally more extroverted, but clearly I'm an example that you can be any type of personality and do well.
All right, so we're getting close to the end. We only have a few more questions left, but these are more reflective questions. So, what did you think you were going to be when you grew up as a kid?
Interesting. As a kid, fairly young as a kid, I thought I was going to be a doctor. I mean, in kind of my early teen years. Before that, I definitely wanted to be a famous movie director, I think was another profession I was interested in.
Is there a different specialty you think you could have done?
A different specialty that I could have done. Not one that I would be as passionate about as I am with GI. I think doing internal medicine, which I have kind of my full training in that as well, as either a hospitalist, working in a hospital taking care of hospitalized patients, or doing primary care is something else that I could do if I wasn't able to do gastroenterology.
If you didn't do medicine, period, what do you think you'd be doing right now?
Oh, that's tough. I would say my fun answer is I would want to be doing something in film, doing something, making either educational videos or entertaining videos for any audience that I could find.
So everyone knows the road to being a physician is not easy.
Mm-hmm.
Were there any times you doubted you would make it as a doctor?
I think that's unfortunately inherent in anyone becoming a doctor, is some level of self-doubt, and I think it changes along the way. I think when you're a med student, you think you can't possibly just learn all the information that you need for a test. You don't do as well on a test as you want to. As a resident, you feel like you're never going to be independent, being able to make treatment plans for others. And I think as a fellow with procedures, with doing colonoscopies, there are definitely days where can't do a colonoscopy and my attending needs to help me out, and I feel like I'm not going to be able to do this. But everything is going to be better with repetition and practice and consistency.
If you could change one thing about the medical field right now, what would it be?
I think preventative medicine and getting people better access to care before they have problems is going to be key. I work in a city hospital primarily in my fellowship, and we see a lot of patients that just don't see a doctor until they absolutely can't stay home anymore, and these are things that we could have helped or fixed if they had come in sooner.
What can a medical student do right now to prepare to go into your specialty?
That's a good question. I think there's often a lot of things. I think whenever there's a specialty you're interested in, trying to seek people out who are already in that specialty, whether that's doing a formal rotation or even just shadowing outside of your medical school curriculum. I think getting to know people in the specialty will help you understand it and help you be able to get the best guidance that you can going forward.
If you were to go back, would you change any of your experiences that got you to where you are right now?
That's an interesting question. I don't think, in a general sense, no. I think I still would have taken the same track, but I think there's a lot of things that, just as people and as medical students, we worry about. And, should I apply to this many programs? Should I apply to this program? Should I ask this person for a letter or this person for a letter? I think there's a lot of little things that there's a lot of unnecessary worrying on. And I think just kind of trusting yourself and that things are going to work out, I think is something I wish that I could have learned a little bit earlier in my career.
Well said. And now, last question, 73. What would you say to the aspiring gastroenterologist right now?
That's a good question too. I feel like I've been saying that a lot, but I think it's really important if you're interested in GI just to recognize that it's going to be a long haul and to focus on each step of the way. If you're a med student, focus on learning as much as you can about medicine overall while focusing in GI, learning more about GI. And then you have to do your internal medicine training. That's one of the unique things about doing GI, for example. You do 3 years of being a doctor that's not specific to GI. So making sure you're the best internist you can be at that point, and then focusing your attention on GI once you get there. I think people can get burnt out or overly anxious if they're trying to essentially become a GI doctor too soon. I think taking each thing in its due time will help you get there and will ease your mind quite a bit.
That was a fantastic ending answer.
Thank you.
That is all I have for you, Dr. Schmidt. Thank you so much for sharing.
Absolutely. Thank you for your time.